There it is. All right. Cool. So, and the sun is like blasting you.
It really is. Maybe I can point the other direction.
There you go. There's your face.
Instead of my grill.
Seeing your face is important. All right. So, this is Tim Benson, and I have known this man for actually quite a long time. I was just thinking about that before we hopped on this call. It's been a while.
It's been at least 10 years, maybe closer to 12.
10 years. Yeah, it's crazy. That's wild to think about. We met at a wellness center downtown and have just been friends ever since, which is so super sweet.
Yep.
Love that. And I run and own True Balance Pain Relief Clinic, where we specialize in pain relief and injury rehab for clients. And I've been doing that since 2010. But I want to hear about you and your practice today. How long have you been? I don't even really know how long you've been in business doing chiropractic and how you started.
I graduated in 2008 from Logan College of Chiropractic in St. Louis. I started my practice there. Things were kind of changing in St. Louis at that time, and we decided we wanted to maybe make a move. Always wanted to live in Denver. Had a buddy of mine that was from here who had started a practice, and it just wasn't taking off. But when he thought about people that would take over for him, my name came to mind. He gave me a call, and that was actually the clinic that you and I worked together at. So got started there, built my practice for almost 5 years there. And when that one folded up as it did, went out on my own, and I continue to stay in that neighborhood, the South Broadway area, and have been treating patients there for, any number of conditions. I am primarily a musculoskeletal chiropractor. I don't do a lot of I would consider what I do to be functional medicine, but what a lot of people label as functional medicine, with things like supplements and I guess addressing more medical conditions. I don't do a lot of that now as a diagnostician. I'm a tenured professor and a department chair at a college, teaching pre-health science classes. So I'm very up on diagnosis, but I tend to refer, if you got a heart condition, probably referring you to a cardiologist, and I'm not going to treat that with try to treat that with supplements. It's just, in my view, I think that's a great adjunctive therapy, but not my area of expertise. Certainly something I can diagnose and work with, but not something I'm really focusing on. Things I've been really good at in the past, TMJD, so people with their jaw problems, and that area's contribution to headaches. I've had great success with that. Definitely your typical neck pain, back pain. I've developed some really good protocols for things like shoulder pain and plantar fasciitis. After we parted, I spent about 4.5 years working in a CrossFit gym. Hey, guess what? That causes a tremendous amount of shoulder problems. Most of the folks I knew through that connection that had been doing CrossFit for more than 5 years have had at least one shoulder surgery. So one of my goals when I was there is to try to keep them away from the surgeons if possible. That's difficult to do when you do a lot of CrossFit, unfortunately. But yeah, so things like that. I've just 15 years of practice in various locations and various places, have developed some expertise. And to be honest with you, Aaron, collaborating with practitioners like yourself, massage therapists, physical occupational therapists, other physicians, even dentists with my TMJD protocols, I've collaborated with them. And that's allowed me to really expand my toolbox and just put more things in there that I can address with patients and make sure I'm helping their problems is what's the word I'm looking for? Completely, I guess, to simplify it as possible, is make sure that we address everything that I possibly can and everything that I've got the specialty and expertise for.
Absolutely. So it's like a holistic one-stop shop as much as it can be.
Definitely. Try to address, and when we identify something that I'm not an expert in, really having that network like yourself and others to refer to.
That's where the team comes in.
Absolutely.
I love that. So you talked a little bit about what conditions you've had a lot of really good success with. What are some of your favorites? Like, what are some of your favorite things, issues to solve for clients, for patients? Patients, clients?
Yeah, patients. I don't get real. It's funny. I teach anatomy and physiology, which you tend to be stuck, kind of stuck on terminology on that. But I don't get stuck on terminology, titles, and things like that. A
Good.
lot of people ask me, "What do I call you?" I was like, "Hey, I'll answer to just about anything, but hey, stupid." So like Tim, Dr. Benson, Dr. B. I hear it all. I'm not picky about that kind of. So clients, patients, whatever.
People.
I will say as a physician, um, we I think you get into your specialty and you get used to things like back pain, neck pain, and for myself, even like headaches. And we see a lot of that, and you get really, really good at it. And you feel like, man, the patient profile comes in, you're like, I really know I can fix this, and that's really exciting and rewarding. And at the same time, as people who are like ourselves that are pretty smart and pretty high achievers, we like to be challenged every once in a while. So I'll say when somebody comes in and I have to think about it and I have to go, okay, I think I can address this. Um, Things like trigeminal neuralgia, I've had a handful of cases, literally about 5 in my career. And 3 out of those 5, and that's one of those debilitating conditions where people are really suffering. It's rare, but when it happens, to know that you can make a difference without medications, without any kind of like invasive injections or surgical procedures. I've had a lot of success for that, and that's hugely rewarding. I talk about those things in my classes when I teach them. I've had other like maybe unidentifiable neurological conditions where I might have thought like, oh, this looks like multiple sclerosis, which is not something that a chiropractor can treat. It's definitely something we can help with. But then working with this patient maybe in conjunction with a neurologist, and seeing them really respond to your care better than they're responding to the neurologist. So, maybe some just really weird, unidentifiable neurological phenomenon. And you don't always have to know why something works to get it to work. As again, as experts in our field and as physicians and body workers and things like that, we really like to understand it because we feel like we can address it better.
Sure.
But you do what works. So I've found a lot of fun and a lot of reward in that, and treating some of those more rare cases and rare patients over the years. It's been a lot of fun.
That's phenomenal. And there's such a need for that because a lot of the time people just they start to feel hopeless and desperate, and they've seen professional after professional. So having someone that's able to say like, hey, for whatever reason, what I do works. If you don't box me in mentally as a chiropractor specifically, right, moving joints or what have you, then
Absolutely.
we can try what I've known to work. So I think
Yeah.
that's super powerful and really needed.
Yeah.
Yeah.
And it develops a relationship with that patient that, man, there's a trust there that uh, can never be replaced. Like that even if you lose touch with that patient for months or even a couple of years, when something else comes up, they're coming back to you. They know that, Dr. Benson or Tim or whoever listened to me and addressed my problem, and it worked. And I got such a great benefit out of it. So that's really what I feel like. I think 2 things that people don't realize about chiropractors and maybe practitioners like yourself as well is that 2 things. One, we're in the relationship business. This is not a situation of like, come in, get your adjustment, barely, hi, how you doing? Adjustment by. Um, I really know my patients. I know what kind of foods they like. I know their families. I know what they like to do for fun, and all that plays into how I'm going to approach them and how I'm going to advise them and how we're going to proceed with our doctor-patient relationship. And that's been the most rewarding thing throughout my whole practice. I really love that. And the other thing I think is, contrary to popular belief, and maybe for chiropractic, this one's especially bad. Um, the good ones are trying to work themselves out of a job. Like, I want to get you well, and I want you to see me less. And I don't want to make my money off you. I want to make my money off your referrals. I want to build that trusted relationship. So when you tell your family and your friends, hey, if you're looking for somebody you can trust, you got to go to Tim. He's the type of person that's going to listen to you, and he's going to meet you where you are and do his best to help you. And if he can't help you, he'll tell you. And then he's going to find you someone who can. So that's really my whole. I think one of your questions was about philosophy, and that is my whole philosophy as a practice, is to try to meet people where they are, build a relationship. And these days, 15 years of practice, I'm choosy about my patients, our clients. And if you looked me up on Google, I might tell you that it's going to be a while to get an appointment with me. Whereas if I ask somebody, hey, how'd you hear about me? And they say, I heard about you from Aaron, I'm going to say, hey, I'm going to move some stuff around and I'm going to get you in sooner because I know that's going to be a really good client. So that network is super important to me too.
Absolutely. And I feel like we all need a team, right? Like our clients don't just need one wellness practitioner for all of their stuff. Sometimes we need a PT and a chiro, and we need like an imaging specialist, or
Yes.
all these different things. We all need a team behind us. I think that's so huge. So I'm
Yes.
really curious. You've been doing this for quite some time, like 15 years. That's a while. I'm sure you've learned a lot, but like, what's something that's been unexpected in your career that's kind of shown up?
I think I alluded to it earlier, and that's when I graduated in 2008. When you graduate from a program like that, where it's so intense and you've studied so hard and you work so hard, you're a little arrogant and you're a little reserved at the same time. You're like, I know I'm a baby chiropractor and I don't know a lot, but then again, I do know a lot. I passed 4 board exams. I went to school all day long for 4 or 5 years, and like just studied a lot, learned a lot, and you get in that pattern of thinking you're really, really smart. And I think the more you practice, you start to realize it's not really knowing everything about how something works. I look at something like I studied as an acupuncturist, but never got licensed as an acupuncturist. It didn't jive with my philosophy as a practitioner. I thought it was something I wanted to do, but it was heavily rooted in a lot of Eastern philosophy, which just didn't resonate with me. But I do have acupuncturists in my network that I refer to, and I really trust and believe in that work. And I can really say I don't understand it. Like, I don't get it. But God, it's powerful. Like, you could see people's lives change. I've seen my own life change. And over the years, I've seen things like Reiki that I've kind of poo-pooed and said, no, this is, it's hooey. And then get a practitioner in an office that I work in an integrated practice that wants to trade. And I'm always open to things like that. And wow, the power and the benefit I get out of something like that, where at one point I was like, no, I don't believe in that. I've really learned to stop saying stuff like that and to trust processes. And even if I don't understand the ins and outs, when things are effective, to accept that effectiveness and, really just open yourself up to it. And it's a lot of people look at chiropractors that way. I think a lot of that perception's changing. But I've had to learn that I need to look at other practitioners that way too, and give things a chance, and really just kind of experience things myself, and try things with my patients maybe that I maybe wouldn't have necessarily tried, new techniques and things like that. So yeah, I guess that's been one of the coolest and most surprising things about my entire practice is being humbled by really wise practitioners that I doubted, and being able to experience how powerful some of these techniques are that we maybe don't necessarily understand all the ins and outs of. So that's been, even in the last 2 to 5 years, super amazing for me. Really opened my eyes, and it humbled me a lot.
Yeah. Yeah. And it's like the bottom line is the efficacy, right? If we're just really going for client outcomes, like let's just stay focused on that. They know
Yep.
what works for them. We can see objective results out here,
Yep.
and blending that all together makes for a really, really powerful experience, especially when you're dealing with, I mean, just people, just humans, which have so many different types of issues that you can't predict. And there's always something fun and exciting right around the corner.
Oh, I know. Yeah.
I
And
love it.
leaving yourself open to that. Like,
Yeah.
yeah, I'm going to check that out. Let's see if it works. And 9 times out of 10, it's been super powerful and it's really worked. Yeah.
Yeah.
Whether
Yeah.
I experienced it personally or tried it with my patients, it's been really, really cool and really powerful.
Yeah. And it opens up so many different ways to help your people, right? Like just staying open and curious and inviting to different methods, just saying, why not?
Yeah, let's give it a try.
I love it. So this has been awesome. We're going to wrap it up. So
Okay.
tell me about your ideal client. Who is your ideal patient? What does that look like for you? Who do you like to have in your practice?
I really like those. I'll be honest with you. It sounded like earlier I was talking trash about CrossFitters. Um, not at all. I really like those people who are, trying to achieve something in their life and trying to do something better. And whether that's, sitting at your home office and, just being more ergonomic, or whether it's doing CrossFit, or whether it's, hey, I signed up for a triathlon and I want to achieve this big goal in my life. I do things like that all the time. Before we started recording, I talked about hiking way too big of a trail at Rocky Mountain National Park, and now I'm super sore and my feet
Yeah.
hurt and stuff like that. Hey, guess what? I need to rely on my my network now. I need my massage therapist and my chiropractors and my acupuncturist. I'm going to need some work over the next couple of weeks. So those are the people that I like, that are really looking for optimum performance in their bodies that they have right now, and realizing that, maybe they're in their 30s or their 40s and they're not 20 anymore, but they still can and they still want to do a triathlon, or they still want to go to that CrossFit class, and putting their body in a state where they can perform properly and heal properly, instead of creating scar tissue and creating bad patterns to avoid parts of their body that are not operating as smoothly or as perfectly as they should, or avoiding areas that are sore and tender. So trying to put their body in a state where they're as optimally suited for that activity as possible. Those are my favorite patients, that are just really out there working and trying to achieve something.
And
Those are super fun.
yeah. Yeah, that's great. So how can people find you?
Um, so basically, I work only by referral these days. I have a small practice. I'm only in there a few days a week, and but we do try to serve the patients whenever we can. So mostly it's like folks like you that are out there to have connections with. Just give them my phone number and they can text me, and we'll set up an appointment. First appointment's an hour. All follow-up appointments are 15 minutes. And I also, when I get a referral from my network, from somebody like you, I give my patients a $10 discount on every service going forward. So a new patient visit's $10 off, and all your follow-up visits are $10 off too. So just trying to extend that appreciation and that discount, not just to you, but also to your patients and your clients. So that's how you get in touch with me, is somebody like you, give them my phone number. Like I said, when I get that Google call, like somebody calls, oh, I looked you up. I Googled chiropractors in my neighborhood. That's not my patient. That's not I want that trusted referral. That's how I've built my practice, and that's how I'll continue to build my practice and help others build theirs, is with trusted referrals. So
What
that's the way to
here?
get in touch with me. Get my phone number from somebody like Aaron.
Awesome. Can do. And what is your neighborhood? Where's your practice
I'm in
location?
South Broadway, so right above the Hornet restaurant. That's at First and Broadway. It's 8 East First Avenue is the address.
Perfect. Love it. Well, thanks so much for your time today. It's always so
Yes,
great to see you.
always great to talk to you, Aaron. You're the best.
Yeah. All right. We'll talk soon.
Okay.
All right. Bye.